Hello, I am Dr. Cindy Rubin of In Touch Pediatrics and Lactation, and I am coming to you today to talk to you about plug ducts. So, my guess is that if you've had plug ducts, you have been recommended to do some of the following things. So, one, I have my dandy breast here. Uh, so, put that down a little bit. So you probably have been told, push that out, push it out, mash on it until it comes out, and putting heating pads over the breast, and maybe even using a electric toothbrush or something else vibrating kind of like this, and to put on there to try to loosen things up. Dangle feeding, so getting down kind of on all fours and having your baby underneath you nursing so that gravity could help to pull out a plug. Those are a lot of the things that get recommended for plug ducts. And that was recommended to me, and I did it. And eventually the plug would come out, but it usually came back, or I would get new ones in other spots. So we think of it like there's actually a plug there that is blocking the milk flow, and you need to just push out that plug and the problem will be solved. And this often happens when people, if they have a supply that is higher than what a baby needs and the breast isn't getting emptied, or if you miss a feeding session or a pump session. It happened to me for the first time when my baby slept through the night for the first time. Lo and behold, the next day, what am I feeling here? So the good news is that plug ducts are most common in the first few months when your body is naturally in kind of a hypersupply, hyperproduction sort of phase. And then over time, your production will regulate to your baby's needs. Especially if your baby is able to feed at the breast, your body will get the messages of how much your baby is eating and will regulate to match that. And usually, once the initial mismatch goes away, the plugs often get much better. But let's go back to what plugs actually are. And really, it's not a little clump of milk like a blood clot in a duct. It's actually inflammation. So it's inflammation that develops in or around the duct that gradually, as that inflammation continues and worsens, it does kind of narrow the duct so that things cannot move through. And there may indeed be like a little bit of congealed milk if it's kind of stuck there in a way and not getting through. It can be very, there's my dog. It can be very tender, sometimes a little bit warm, a little bit of redness. If it is simply a plugged duct, it will not be associated with systemic symptoms. So you won't have fever, chills, things like that. You won't feel sick, but you may be very, very sore. And a lot of the time, if you just simply do nothing, the plug will resolve on its own if you just continue regular emptying of your breasts. The inflammation will go down, and your body will regulate if your baby went a longer stretch between feedings or something like that, and it will resolve. Things that can help initially are pain medicine, specifically anti-inflammatory medicine like ibuprofen. Tylenol can also help though, especially with pain. And ice, because ice, if you think about like a sprained ankle or something like that, it's kind of similar. You get inflammation, and the initial thing that you use is not warm, it's actually ice to decrease that inflammation. So ice, got some ice right here. So ice in the area of the plug, and ibuprofen, that and emptying may do the job in and of itself. One of the main points that I want to make is that this kind of mashing on the breast that people are advised to do, and I think tempted to do just because of our thinking of, there's something that needs to be pushed out there. I did this, and again, eventually it would clear usually, but it really just creates more inflammation. You're essentially kind of traumatizing the tissue. And think about your breast. It's a pretty sensitive organ of the body, and there's no reason to be so aggressive with it. You want to treat the breast gently. So, in fact, we really want to be generally hands off and not mashing on the breast at all like that. That may give you the perception that it helps, but really it's probably just going to make you more prone to having more plugged ducts because you're leading to all of this inflammation. The kind of massage that can be helpful is something called lymphatic massage or lymphatic drainage. And, this could be a whole video in and of itself, and maybe I'll do that or I'll have a guest on at some point to show us this in more depth. But what lymphatic massage is essentially loosening up the fluid that is building up there and the inflammation and letting it drain through our lymph nodes and our lymphatic system where it gets resorbed into the bloodstream and goes away. And that's how we clear infection and inflammation in our bodies. So the way you do that, just very basic for the breasts, is you can start, let's say you're feeling very engorged or uncomfortable, you've got a plugged duct, you're about to nurse or pump, and you clearly haven't been emptying as well in that breast since you got the plug. Starting with just kind of almost lifting your breast off of your chest, just a gentle kind of lifting all around. You can do some little gentle circles around your breast. And some tapping of the breast sometimes can feel good. You may even find that you have a letdown as you're starting to do this, just kind of loosening things up. And then there's a kind of petting like a cat, the breast back towards, I gotta figure out where I'm located here, back towards your armpit, because that's the direction that things tend to drain. So kind of gentle stroking back towards your armpit. And really, you would not do this more deeply or strongly than you would be petting a cat. Believe it or not, these things really can help with the inflammation. That, in conjunction with doing the ice and the anti-inflammatory medicines and being patient and trusting that your body will take care of it, those things go such a long way. And really just being assured that it is not something physical that you need to push out. Because again, that's more likely to, over time, lead to chronic inflammation in the breast, which leads to you being at risk for developing more plugged ducts, as well as potentially either just inflammation mastitis, where you do start to feel some systemic symptoms like fever, achiness, things like that, or even an infection in the breast. So we really want to minimize the inflammation as much as possible. You really don't want to use anything that vibrates. There are a lot of things out there that are marketed for this, and really want to stay away from that and stick with ice. There may be, like, if you have a low milk supply and you're trying to up your production, there may be a place for some warmth to kind of get things moving and the blood flow going before an emptying session. But generally, it's going to be frequent icing, really around the clock ibuprofen while you've got the plug duct, and the very gentle massage or just hands off altogether. Another thing that can help is lecithin. Lecithin is an emulsifier that basically breaks down the milk particles so that it makes them less sticky. So they are less likely to kind of clump up and get congealed, which may happen as a result of this inflammation. So lecithin can help. And I will put my generally recommended lecithin dosing in the notes. And taking care of yourself, so getting some rest can help. Trying to figure out is there what led to, what triggered it, and see if you can work on kind of nipping that in the bud or fixing whatever that is. So if you think that it is that you are having more milk than your baby needs, if this is in the early weeks and months, it may be something you just kind of have to hang on to and wait for things to downregulate. But some people really have a persistently overproduction of milk. And there are a variety of things that can help to decrease that and improve that. Sometimes it's just that your baby is not getting the milk out efficiently or adequately. And so there is a lot of milk left in the breast. And what happens is when that breast is full, we actually know now that that leads to lactose in the milk leaking out into the tissues around the alveoli that hold the milk. And that is what that leads to inflammation. So the less milk is just sitting in the breast, the less inflammation we're going to have. So that's again where the frequent emptying comes in. Another thing is making sure that there's not, was it a position that you slept in that made that kind of provided a little bit of trauma or caused some inflammation to build up in a part of your breast, or a bra that you're wearing or not wearing that is causing there to be some pressure points in your breasts. So that's something to look at. And if these are persisting despite really following all of these recommendations, and there could be other things going on. So reach out to a breastfeeding professional to help to evaluate you to see if there's anything more going on. Very importantly, if you have a plug or a lump that persists and never really completely goes away, or for weeks and weeks, or keeps recurring in exactly the same spot, that's something that you really do want to get evaluated by a physician, and they can decide if there's further things that need to be looked at to make sure that there's not anything significantly worrisome going on there. And checking into that sooner rather than later is a good idea, especially when you're lactating. So I think this kind of sums up what I really wanted to get across. If you're used to doing all of this mashing, I think it can be really hard to change your mindset to stop doing that. I know that it was hard for me. And you may be nervous that it's just going to get worse if you stop doing those things that you perceive to have been helping you. But I guarantee it won't make anything worse. It probably will get better. And if it's not getting better, then there might be something else going on that has to be checked out, and seek out the help of a breastfeeding medicine physician or another breastfeeding specialist, professional, a breast surgeon, your OB-GYN, your primary care doctor, whoever might be able to lead you in the right direction to evaluate something that's persisting. So let me know if you have any questions, and you can find me in the Chicago suburbs at In Touch Pediatrics and Lactation. And I also provide some educational packages for moms throughout the state of Illinois who want a little bit of prenatal help and a little bit of postnatal help to get their breastfeeding journey underway smoothly. So I hope you enjoyed this. Please share it with somebody else who could use this information. Subscribe to my YouTube channel, and feel free to contact me with any additional questions or things that you may want me to go over in a future episode. Have a great day. Bye-bye.